Hello, this is Mohammed, and I will be discussing about hospital management and healthcare industry using data analytics and AI. The American Hospital Association did a research, and they found that in 2022, out of the registered 6,120 hospitals, they observed over 32 million patient admissions in the US, an overwhelming number. In the same year, the CDC did another research, and they found that 46% of health workers reported feeling burned out. I took a snapshot from the CDC, and we see from the chart the red line representing burnout. In 2018, 33% health workers reported feeling burned out, and in 2022, that number jumped to approximately 46%. AI and data analytics can be applied in various areas of health management, such as personalized health recommendations, managing hospital medication and supply chains, monitoring complex risk and compliance laws, and patient engagement. I will now give an industry overview. 90% of hospitals adopted an AI strategy. 41% said they were in a planning stage, and 25% said they were in an early implementation stage. However, Dr. Steve Gollins, a healthcare tech investor, pointed out that there was reluctance from doctors in adopting AI tools to treat patients. So we see a contradiction here. We see on one side, hospital management and healthcare executives are willing to adopt AI strategy, but there's a pushback from healthcare employees who directly deal with patients. And the reason is simple. The reason is healthcare is a very sensitive area. If AI tools get their predictions incorrect or the results incorrect, then it can impact the lives of patients. But I will point out that some of America's top hospitals adopted AI/ML and data analytics, and they have benefited tremendously from them. The first is Johns Hopkins Children's Hospital, and they use predictive analytics to find out if any children need emergency treatment. They cross-reference hundreds and thousands of cases in the past through AI tools to get to the results. The second is UCLA. UCLA implemented a chatbot. You can see from the screenshot on the right. You can make an appointment. You can find a doctor. You can have billing questions. You can describe your symptoms, and the chatbot is smart enough to redirect you to a specialist for your diagnosis and procedure. And you can even communicate in different languages. Lastly, I want to point at Mayo Clinic, and they use AI/ML for detecting heart disease, quicker stroke treatment, and improving diagnostic radiology capabilities. I will now highlight two major problems faced by the industry. According to a Forbes article, there is an overwhelming amount of paperwork for medical professionals on collecting and validating patient information during a visit. Doctors spend nearly two-thirds of their time doing paperwork. They ensure that the information entered in the electronic health record, or EHR, is correct. They check for vitals, allergies, past medication history, family history, past diagnosis and procedures, and so on. Regulations enforce that there are some information or updates that only doctors can make. Instead of being overloaded with paperwork, doctors should spend more time in patient engagement. The second problem is hospitals need to maintain a steady supply of medication to manage their inventory and treat patients. Analyzing historical data can be an overwhelming amount of work in predicting how to stock medicine for hospitals. A related problem is traditional models can take a long time to react and are slow to change. For example, we have the COVID-19 pandemic, and traditional models may work when circumstances are not so volatile. But if sudden changes happen, traditional models cannot adapt to those changes fast enough. To address the first issue, we can use AI-powered chatbots. As an example, K-Health, a startup healthcare technology company, provides medical advice by deploying AI chatbots that gather patient information such as vitals, symptoms, and medical history, and even suggest potential diagnosis. They found that about 84% of the time they give or suggest the same diagnosis a medical professional would advise their patients. Unlike handwritten medical forms, the chatbots can also validate the information that is being entered. So if there are some fields, mandatory fields, for example, blood pressure reading, you want blood pressure reading in standing, sitting, and supine position. If you enter an abnormally large number, the chatbots can detect that and force re-entry of the information, and that can be captured directly to the database for acknowledgement. So this saves medical professionals a lot of time. We can see from the screenshot on the right, someone is complaining about the shortness of breath, and all the duration that is being listed associated with the question, how long have you been short of breath? And it gives you a selection of numbers, hours, days, minutes, so on and so forth. To address the second issue, we can refer to what David Burton Harris said. Supply chain management with AI/ML and data analytics tools can help operation management specialists maintain optimal inventory of items. So we take this concept and we apply them to medication inventory for hospital management. Data analytics can generate predictive models that can help in decision making, reduce costs by monitoring medication stocks so they do not expire, and improve patient safety by ensuring the medication is available. AI/ML can help predict inventory demand and maintain optimal stock levels. When it comes to ethics and law, federal regulation on healthcare information is safeguarded by enforcing the HIPAA privacy rule, as mentioned in Section 164.506 Code of Federal Regulations. The rule restricts the use of one's personal health information without the person's authorization or knowledge. In a study conducted by Mayer, it was revealed that 40% of physicians have concerns about patient privacy. We have to be especially careful with the AI application because they pose a potential risk of reading information from logs and emails. These sources are often not intentionally fed to AI/ML models, and they can interfere, firstly, by making the data quality poor and therefore giving incorrect results and predictions, and second, by accidentally sharing the information with unintended parties. As part of future thinking, with time, federal regulations will ease and AI augmentation will be used for clinical care. FutureScan did a survey in 2023 with health executives, and the response was 3% believed that it was already happening, 27% said it was very likely, 23% said it was somewhat likely, 29% said it was neutral. With time, more hospitals will adopt AI chatbots to capture patient information accurately. With time, automated medication inventory management for hospitals will be maintained with better accuracy, leading to less wastage of medication and readily available medication for all patients. As a conclusion, I want to mention that with time, application in hospitals will include personalized health recommendations, hospital medication supply chain management, and patient engagement powered by AI and data analytics. As a personal thought, I believe AI/ML can significantly improve patient treatments and make hospital management easier. But it needs to be implemented carefully so as not to jeopardize our trust in the technology. As patient care evolves, AI/ML and data analytics will play a vital role and help to improve human lives. I hope you enjoyed my presentation. Thank you.